Okay, good morning. My name is Harsha Kaur from BMI Core 10, and today I'm going to be presenting about on my research topic, which is the level of information received by patient prior to CT coronary angiography (CTCA). So my supervisor is Sir Rao, and my co-supervisor is Dr. Dinesh. Okay, so this is my introduction. Okay, so CAD occurs when cholesterol and plaque build up on the inner walls of the arteries, narrowing and hardening the arteries that supply blood to the heart muscle. And the buildup of the cholesterol and the plaque is called arteriosclerosis. Okay, and then the scarcity of information on CAD, which is coronary artery disease, and its incidence in developing countries. However, from 1990 to 2020, it is expected that CAD death rates will double in the developing world, accounting for an increase in 82%. Okay, and then the coronary artery disease can be ruled out in patients with low to intermediate pretest probability of disease with the help of CTCA prior to invasive coronary angiography. And in generalized linear model study, coronary CTA with more than 64 detectors was linked with better specificity as compared to the lesser than 64 detectors, although sensitivity remained high for both the more than 64 detectors and the lesser than 64 detectors. And these findings are clinically noteworthy because they suggest that coronary CTA could be utilized to rule out severe CAD in valvular heart disease in patients with valvular heart disease using a variety of technological scanners. Okay, so there is a growth in the number of patients who undergo CTCA, and the radiation dose delivered to the patient is actually high when using CTCA. And the radiation exposure from 64 sections CT coronary angiography has contributed to the risk of cancer in relation to the patient age and sex, especially in young women due to more vulnerable to radiation exposure. Okay, so next we go to the problem statement. Okay, so the problem statement here in our research, okay, the first point, it is important to diagnose stable coronary artery disease at an early stage to reduce morbidity, mortality, and heart healthcare costs. And the next point is, patients with lack of briefing tend to experience a significant level of anxiety while performing scans. So when they're not given the proper briefing, their level of anxiety will usually it will increase because they are unsure of what is going on during the procedure, during the CTCA procedure. So when this happens, when the anxiety level increases, it will lead to patient lack of patient cooperation throughout the procedure, which will ultimately cause image quality degraded. It will reduce the image quality, and also it will increase the patient dose because you need to repeat the procedure again. Okay, next, justification of this research. Okay, sorry, you won't be able to see. Okay, okay, so the outcome of the study will reveal the level of information received by patient prior to computed tomography coronary angiography, which will be useful for planning future intervention method. So for the patient side, it will help to re-evaluate their need and rights for adequate information pertaining their CTCA procedure, which could lead to better cooperation given by them. They'll cooperate more in terms of um, preparation before the CTCA procedure begins. And also through this research, you actually encourage them to actually put in the effort required to increase their level of information so that they can be more prepared for the procedure. Okay, and as for the management side, they um they can actually identify the factors that might hinder CTCA patient from receiving the information given accurately, which will help them to prepare better pre-examination guidelines for patients that will take into account all these factors and ensure excellent patient preparation prior to CTCA procedure. Which means the management they'll be able to provide better guidelines, therefore able to provide proper briefing to the patient before the procedure so that their anxiety will be low Therefore, they'll be able to cooperate more throughout the procedure. Okay, so next is the research question. Okay, so the first point is, what is the level of information received by a CTCA patient prior to procedure? And the next point is there any relationship between demographic factors and the level of information received by patient prior to CTCA procedure? Okay, so next is research objectives. The general objective is to measure the level of information received by patient prior to completed tomography, coronary angiography. And the specific objectives is to determine the level of information received by patient prior to CTCA and also to identify the demographic factors that influence the amount of information received by patient prior to CTCA. Okay, and so the research hypothesis. Okay, so the level of information received by patient prior to CTCA might be low. That is the first hypothesis. And the second one is there would be no relationship between demographic factors and the level of information received by patient prior to CTCA procedure. Okay, so the literature review. Okay, so these are one of the few main references articles that I took. Okay, so as you can see here, CAD is the most common type of heart disease, especially in women and men, and is the leading cause of death in the United States. And CAD occurs when the arteries that supply blood to the heart muscle becomes hardened and narrow due to cholesterol and plaque built up in the inner walls of the arteries. Okay, this is from coronary CT angiography, anatomy, and ECG ND. The next one is also from the same notes, from the same article. Okay, so CAD can be detected by using different types of tests, such as chest X-ray, ECG, stress test, echocardiogram, coronary CT angiography, MR angiography, and cardiac catheterization. And the CTCA provides the highest resolution on the information of the cardiac anatomy. It provides an assessment of the cardiac function, and also it is best known to be rapid, straightforward, and non-invasive. Okay, so next is for Maffei ETL 2010. Okay, so this is based on a study done on 236 patients who were at moderate risk and were suspected to have CAD, who underwent stress ECG, CTA, CTCA, and CA. Turns out CTCA provides a higher diagnostic accuracy as compared to stress ECG in symptomatic patients with suspected CAD and moderate cardiovascular risk. Next is Smith-Bindman ETL-ND. As compared to about 1 in 8,100 women of the age of 40 who underwent a routine head CT scan, 1 in 11,080 men, about 1 in 270 women of the same age who underwent CT coronary angiography will develop cancer from that CT scan, and it is 1 in 600 men, sorry. And for Coles ETL 206B, the results show that for patients who are being diagnosed for coronary artery disease, multi-site computed tomography, coronary angiography delivers higher effective dose of 14.7 MSV, standard deviation of 2.2, as compared to conventional diagnostic angiography, which delivers an effective dose of 5.6 MSV, SD 3.6. And for the last one, standard of practice computed tomography. Okay, the CT department must send additional information to the patient before they attend, which is patient information leaflet, which provides detailed explanation on the procedure conducted to reduce patient anxiety. Okay, so next, this is the research methodology. The research design is descriptive cross-sectional study. The study population is on CTCA patients in KPG hospitals around central region of Malaysia. And the study sample and the study method will be using Krejci and Morgan 1970 table to determine the sample size with the known population. And based on the calculations we have done, the sample size for my study based on Kretzy and Morgan table is 140. But it will be increased by 10% to ensure minimum sample size is achieved after dropouts and non-response or missing records. So therefore, the new sample size will be about 154, sorry. Okay, as you can see here, these are the KPG hospitals, and these are the cases of CTCA per month, respectively. Okay, so yeah, I'll be taking about 154. Okay, so 140 increase in 10%, so I'll be taking 154. Okay. Inclusion criteria would be post-CTCA procedure patients, first time undergone CTCA procedure, patient aged 18 to 50 years old and willing to participate. That's the inclusion criteria. The exclusion criteria is inpatient and in critical condition post-CTCA. And the study instruments is self-administered questionnaire. So the methods of data collection is a questionnaire will be used to determine the level of information received by patient prior to CTCA and to identify the demographic factors that influence the amount of information received by patient prior to CTCA. And the socio-demographic information will include age, gender, race, occupational education level, language spoken. The patient is required to confirm their participation in study by approving the consent form. It is compulsory for the patient to answer all these questions stated and submit the form and the answers obtained. Yes, and the form and the answers obtained will be recorded and graded as well. So this is the flowchart. Submission of ethical clearance forms first, then the pilot study, then the selection of subjects, then check for eligibility, and if it's not eligible, you'll be excluded, and if it's eligible, you'll be included. Then we'll be giving the respondent information sheet and the respondent consent form. Then after that will be the data collection and then data analysis and then the findings. And as for statistical analysis, will be performed by using IBM SPSS, the 26th version. So descriptive analysis will be used for the first objective, which is to determine the level of information received by patient prior to CTCA. Logistic regression tests will be used for the second objective, which is to identify the demographic factors that influence the amount of information received by patient prior to CTCA. So this is my Gantt chart, okay, from year 2021 to year 2023, as you can see here. And this is my reference, all of it. And that is actually all from me. Thank you very much.